The reason that we do this is a lot of our patients are on dexamethasone, and dexamethasone can cause muscle weakness of the neck and the hip flexors. So, as a neurology NP or a neurologist, you want to always be checking for weakness because it's something that you can find before it becomes a problem, and it is our job to try to avoid problems. After this, all your cranial nerves are examined. You also want to make sure that you ask the patient, how is your hearing? And you kind of rub your hands near their ear. And if they tell you that they have a problem with hearing, you ask about the history or if they've ever been asked if they need hearing aids, or if they hear better on one side or the other with their phone, or if they have ringing in their ears. You also want to ask them if their smell is appropriate. They will tell you if they can't smell, and there are things that you can do for that, but you don't need to focus on it. You just need to make sure that it's not a problem. You also want to ask them when they eat if things taste appropriate. In the oncological setting, a lot of chemotherapy medications can alter taste, and the person will tell you, since starting chemo, my taste has been altered. But it is important to make sure that they have adequate taste so that you're not missing a peripheral neuropathy on their tongue. Because if they all of a sudden can't taste anything on one side or the other, that is a separate issue and that is not a chemotherapy based issue. You also want to make sure that you ask them while performing a cranial nerve exam how their swallowing is. Do they have any difficulty swallowing thin liquids or regular foods? This will tell you a lot about how their throat is working. And if they report problems, it is always important to have a speech language pathologist to come and evaluate them for a swallowing examination. This is always about patient safety, and it is our job as neurology to be asking these questions.